In industrial accidents involving machinery, there's a critical window, often just 60 seconds, where the response determines whether someone survives, retains function, or dies. This makes worker first aid knowledge not just helpful, but potentially life-saving. Machinery accidents create specific injury patterns that require specific responses. Traumatic amputations need immediate tourniquet application and proper handling of the amputated part. It needs to be wrapped in moist, sterile gauze, placed in a sealed bag, and that bag placed on ice, never directly on ice. Crush injuries require pressure to control bleeding, but movement can worsen damage and cause deadly complications like crush syndrome. Abdominal eviscerations, where internal organs are exposed, need moist, sterile covering. Never try to push organs back inside. The problem is that most workplace first aid training focuses on minor injuries. Cuts, burns, sprains, yes. But catastrophic trauma from machinery accidents? Rarely covered comprehensively. Yet these are the situations where first aid knowledge makes the difference between life and death. Industry-specific protocols are crucial. First action: stop the machinery immediately. Hit the emergency stop. Don't try to rescue someone while equipment is still running. You'll just create a second victim. Second, call for help while beginning treatment. You need professional emergency services, but you also need to start hemorrhage control immediately. Third, specific techniques for common injuries in your industry. Comprehensive training should include hemorrhage control using tourniquets and pressure dressing, shock management including positioning and maintaining body temperature, and coordinating with emergency services to provide critical information about the mechanism of injury and treatment already rendered. There's a legal framework here too. Employers have requirements for on-site first aid capabilities based on workplace size and hazards. When inadequate emergency response worsens outcomes, when someone bleeds out because nobody knew how to apply a tourniquet, when someone dies from shock because nobody knew basic stabilization, there's potential liability. Workers' compensation implications can be significant if employer negligence in emergency preparedness contributed to poor outcomes. But there's another dimension to this that doesn't get discussed enough: the psychological burden on coworkers who render first aid in horrific accidents. Imagine being the person trying to stop your colleagues bleeding from a severed limb. Imagine being covered in their blood, hearing them scream, feeling the weight of their survival being in your hands. That's traumatic. Those workers need mental health support, access to counseling, and recognition that what they experienced was psychologically damaging even if they performed heroically. The bottom line is this: in high-hazard industrial environments, first aid training should be trauma-focused, specific to likely injury mechanisms, and regularly practiced. And it should be recognized as a critical safety layer, not an afterthought.